2 News at 6:30.
Well, it still looks pretty bad out there, but believe it or not, the smoky weather is starting to improve a bit, at least from yesterday. But will we see a return to the unhealthy conditions later this week? A look at your weather forecast. But first, new details on the COVID-19 case that's caused students at Marcy Hers Middle School to be excluded from class. What we've learned today.
Absolutely concerned. We're following those numbers across the country.
The number of new COVID-19 cases is on the rise in Washoe County, and that includes cases among children. Continuing coverage of the pandemic tops 2 News at 6:30. Good evening, everyone. I'm Ryan Canaday. Kristen's off tonight. Thanks for being with us. COVID-19 cases among kids are rising across the U.S. The American Academy of Pediatrics says nearly 94,000 cases were reported in children between July 29th and August 5th. That's just 1 week. The report says the number of kids contracting the virus has increased 5-fold since the end of June. Well, COVID cases among kids are also on the rise here at home. Cases among kids and young adults under 20 are 4.5 times higher than just 1 month ago. Paul Nelson shows us what one local hospital is seeing.
More and more kids are catching COVID-19 during this latest surge of the disease.
I'm sure you've seen the stories about children's hospitals filling up in Florida. And so we're aware that there is the potential that we could have many more cases in children occurring in our community with the Delta variant.
Between June 11th and July 11th in Washoe County, 45 children under 10 caught COVID-19, and there were 71 cases in the 10 to 19 age group. But in the last month, cases among younger kids jumped to 195, and there were 323 older kids and teens that caught the virus.
It's exhausting. It's emotional. We want to protect our kids. Everybody's calling me. Can they get a shot for their kids? I've had so many calls like that.
3 kids are in the hospital here at Renown with COVID-19, and the concern is that as cases rise, so will hospitalizations.
I'm very nervous about it. I'm concerned. I just want to do what I can to protect my daughter and also other kids in the community.
Carly McCutcheon's 3-month-old has been in and out of this hospital since she was born. Not for COVID, but the virus does weigh on her mind.
I'm very concerned about how COVID would affect her development, especially, she's a child that has had other medical issues and has had to be in the hospital.
While cases are going up in kids, they're also on the rise in adults, so the percentage is about the same as the last surge. Like adults, the severity usually depends on underlying health conditions.
Our teenage children, our children who are obese or have other medical conditions, are the kids that we're seeing get admitted to the hospital.
Dieter encourages everyone who's eligible for the vaccine to get it and wear a mask.
The kids in the population 12 and up can get vaccines, and we're hoping to not see as many of that population, but we're still very concerned about the children under 12.
Covering the story, Paul Nelson, 2 News.